help get rid of it. But again, along the route of lymph nodes, which serves as tiny filters to remove debris. Debris is anything that shouldn't be there. It's almost like saying it's junk. Like, if, for instance, analogy for that would be if you ever were out in maybe a windy day, dirt flies in your eye, you go to the ER for whatever reason, maybe you had a scratch or corneal abrasion, whatever. A lot of that is considered to be foreign. So anything that shouldn't be there would be foreign. Debris is almost like waste or junk that shouldn't be there. Okay. And you'll see that or hear that word more often, like in a wound care setting, or you're doing wound care on someone, and they would ask you to clean the debris off the wound. So, along with the route of lymph nodes, you filter and remove debris. Macrophages exist in the lymph nodes and digestive area. Lymph nodes do become swollen in response to infection and also tumors like cancers and things of that nature. And that's the reason why when people are diagnosed with cancer, specifically, I'm speaking about, for instance, breast cancer. A lot of people that have breast cancer, they often not only get a mastectomy, but they also remove their lymph nodes because now the cancer has traveled to those cells and they need to remove the lymph nodes because they have been infected and it's possibly a chance that it can become metastatic, which it can travel. Okay. So the thymus, at birth, your thymus is actually larger at birth than it would be in an adult phase. So your thymus lies beneath your sternum. Your sternum is also known as the breastbone. We talked about that because we're doing EKGs, but in any event, it's a large in infants and filled with lymphocytes. In order and I'm sorry, in the order of a cortex, the thymus and lymphocytes are produced to remove or move medulla of a organ as mature. The spleen, however, is the largest lymphoid organ, and it filters blood to remove old, worn out red blood cells. And even the spleen must remove because disease or injury. For instance, liver will take over function, lymph nodes defer after lymph nodes, and they are not surrounded by a capsule, but any event, tissue making of these sets or tonsils, such as your adenoids. You have people with tonsillitis and things like that, and they need their adenoids removed, which is in your sinus area and tonsils as well. Is an example of lymph nodes. So the appendix throughout it to be composed of lymphatic tissue. There's something called the Peyer's patch, which they are collections of lymph nodes found primarily in your ileum of your small intestines. So basically, what this is saying is, or what I'm saying is, you have things throughout your entire body to help fight off infection given the area that it's been invaded with. Again, if you have a compromised immune system, then obviously your ability to fight off different things won't be, as same or able to work as hard as someone that's fairly healthy. So, defense against diseases. Now, non-specific diseases such as innate immunity, which is the presence of birth and does not have to learn throughout exposure to a pathogen. There's almost an immediate response when this takes place, especially when a foreign object or antigen invades the body. Innate immunity will have no memory of an encounter and does not provide any ongoing protection against the future infection. So, for example, guys, if we were to be infected by a cold, we got the cold, your body's able to replicate those germs, so to speak. And what happens is, if you were affected by it or you came in contact with that same type of a infection, your body has built up a defense mechanism. Hey, I know you. All we need is basophils to kill you, or all we need is neutrophils to kill you, or eosinophils, whatever the type of infection is, it will send that party of those white blood cells are ready to fight you off because it recognized you, or recognized the infection, should I say, as foreign and not should be there, right? Okay. So, because species are resistant, because we do have some infections that are resistant. And what that means is you have some infections that antibiotics could cure, and you have some infections to where the antibiotic is resistant to it. So if you ever seen, and we talked about this in old classes as well, if you ever seen where you had a culture, like a urine cultures or sputum or whatever type of a culture you would be looking at, more than likely it will have a pathology report on that culture. So it would solidify what can cure the disease or infection, sorry, and what won't cure it. Basically, if it's curable, it'll say sensitive to Cipro or moxicillin or Bactrim or whatever the antibiotic will be. But if it's resistant, it will have an R by it, like we learned in old classes, and it will be resistant to it. The bad thing about something being resistant is that more than likely the patient will need a not only oral antibiotic, but they would need an IV antibiotic like Zyvox and things like that. And sometimes they even need the antibiotic a little longer than expected. Like the normal antibiotic course would be from anywhere from 5 days to 10 days, sometimes in between, like a 7 day. But when it comes to 21 days and a month and 2 months, like I told you guys, when I had MRSA, I had to undergo treatment for 2 months, two different antibiotics. I'll never forget. One was called rifampicin and the other one was called doxycycline. I had to stay on that antibiotic for 2 months exactly. So that was unusual to me, to say the least. But in any event, humans do not get most diseases infected by plants or animals, but skin and lining of bodies serves as a protective lining, like we talked about yesterday. So when you are in a position to where that protective lining has been broken for whatever reason, whether it was a needle stick, whether it was a laceration or scrape or anything of that nature that will cause that skin area to break apart. Now you've been exposed. Um, there's other chemical barriers. Chemical barriers would be something gets into your eye. What usually happens is that you tear up, right? That's your body's defense mechanism saying, hey, let's get this thing out of this person's eyes. Sweat is also another chemical barrier as well. So those would be, different examples of chemical barriers. Now we do have phagocytosis, which is a cell that eats one another. Basically, the term phago means to eat. So phagocytosis are cells that eat pathogens or other unwanted cells that eat, when things come about. Of course, they're elevated during body temperature changes. They're accompanied by fever. They can cause the liver and spleen to remove iron from the bloodstream. Pathogens which need iron to survive will die. Some pathogens needs another living host, like a parasitic pathogen. They need a living host to survive. So it just depends on what you're being affected with or what the person's being affected with. However, inflammation dilates body blood vessels and allow white blood cells to bring in more phagocytes, which we learned about that. While redness, heat, swelling, and pain, and also inflammation may be uncomfortable, it's our job to take notes of those things so we can then tell the doctor, hey, these are the symptoms the patient is experiencing, and those are the symptoms of or all the signs of a infection. So if there's a boil abscess that has been affected or like an ingrown hair, those are all the signs. Redness to the eye, right? It may feel a little warm to the touch. And of course, you will visibly see the swelling. And the patient may feel pain. And of course, fever is there, especially within the first 48 hours of being infected. So the end results is it results in a beneficial to the body. You do have natural killer cells, primarily target cancer, but will also destroy pathogens as well. Antigens, defense mechanisms, and this is your immune system, guys. And your immune system is very important in general. Like I said before, without it working properly, you would be more than likely exposed to everything or the patient and be just more susceptible to get just about anything that they're exposed to. Um, so antigens, specific defense are known as immune system. However, pathogens have an antigen on the surface, which can be viewed as an enemies of the body. However, these are the enemies that are small to start. However, they're known as peptins, which are antibodies, and complainants are proteins which can be viewed as defenders of the body as function to remove the antigens. Um, there's a complement system consists of about 30 proteins that act in a sequence. And you'll find proteins everywhere, guys. Proteins are in cells, proteins are anywhere in the human body that you can think of. And that's why nutrition is so important. However, one protein activates another, and so on and so on. The sequence of cell are called the complement cascade. Cells of the lymphatic system then produce protein known as cytokines. Cytokines are messenger cells. So messengers of the immune system, which in terms, if your body is infected with an infection, it will message the white blood cells, hey, we're in trouble, I need help. Certain other kind of cells of the immune system produce cytokines, which in turn then antigen is detected. And remember, the antigens are very important because, hey, it can remove the infection, but also replicate it as well. Lymphocytes and macrophages. Macro means large, guys. Micro would mean small. Okay, so produces cytokines. They're known as monokines, which releases the B cells production, and also stimulate bone marrow. Where's bone marrow produced, ladies, gentlemen? Where's your bone marrow produced? Anybody know? Bone marrow. Where is it produced? Hmm. Chelsea, you guys listening? Where's bone marrow produced? Anybody has a clue? Go ahead, Danielle.
I'm gonna take a guess. Is it um like what did I read? Like center of bones? Something
Oh,
like that?
you're Googling. Okay. So the bone marrow is produced in your femur, guys, right? Right at the hip site. So it's produced in your medulla cavity, which is in the center of the bone. As you all know that your bone marrow do produces this thing, and it does happen quite often. And oftentimes, those that need bone marrow transplant is very painful. Like I said before, most times they will do it while the patient is awake, may have a minimum sedation, but usually they're awake. I've heard that it's very painful in a sense. So, your bone marrow produces white blood cells. It also produces T blood cells. Yes, there's red and there's yellow. So, in the medulla, what Chelsea is saying, let's say you're a baby, an infant age, it's red bone marrow, right? But and when you get older, it turns to yellow bone marrow, which in turns to fat. Okay. Um, so it produces in the medulla cavity in the same area which I was just speaking about. But I didn't want to quite get off topic with that. That was for another um, lecture. But any event, I was just asking to see if you all kind of was listening still in any event. But any event, so okay. So it's producing a bone marrow along with T cells. T cells, you will see that a lot too when a patient has HIV or any autoimmune disorders where their cells are being constantly attacked. Okay, so it produces white blood cells. It also produces T cells, which synthesize to antigens to help attack as well. You have target cells, you have T cells that stimulate the production of lymphokines and that activates macrophages, and antibody mediated response occurs in fluids rather than the cells in the body. Now, to differentiate this unique molecule on the plasma membrane of cells called the major histocompatibility complex, also known as MHC, are used as means of identification. So, of course, it needs to identify what is coming in contact with, okay? But you'll see in patients that have like autoimmune HIV or full blown AIDS, a lot of times they will get their T cell count and also white blood cell count and things like that, just to see if the medication is working up to par and things of that nature. So you may not see this on a regular, but those are some of the reasons as I can kind of come up with that you would definitely see it in. So immunoglobulins, guys. Immunoglobulins are basically combat antigen. They're able to combat, and that means fight off different infections in layman's terms. The body may be mistakenly make antibodies to against itself. Remember, I said if a patient has I forgot which blood type. I'm sorry for that. It's either Rh negative or O positive. One of the um I would say universal blood types, but they can't take everyone's blood, but they can almost, administer or give a blood transfusion to anyone. But any event, of course, with a type and screen. But um, with them, if they become pregnant, lose the baby, get pregnant again, the body fights itself. And so that's almost the same difference as that. Thank you, Danielle. I couldn't remember. That's almost the same thing as what they're saying here. Your body literally fights itself. So a different disease mechanisms and different disorders that I've put on the board for you guys to study, you'll find that a lot of those immune disorders end up fighting their own body. For example, alopecia is an autoimmune disorder where the body fights its follicles. Okay. Lupus would be another one that the body fights, their skin and different organs in the body, depending on the type of lupus you have. AIDS, of course, or HIV is an autoimmune disorder that fights itself as well. So when you think about antigens that are fighting itself, you want to think of those type of diseases. Now, in order to treat the patient correctly, um, you want to understand why the doctor is ordering either IgA test or IDG or IgE or even IgG or IgM, because all of them have different reasons behind it. So, for example, if the doctor orders a Hep B screening or STD, a lot of times you'll see on your requisition form some of these that's listed here on your screen, and maybe it doesn't make sense to you. Um, or maybe it will make sense. Hopefully after this, it will make sense to you if you do see it. You say, okay, it does ring a bell. Even if you don't know all of them at once, it's just good to understand why he's doing what he's doing or why she's doing what he's doing. But in any event, autoimmune disease, IgA is found in high concentrations in mucous membranes, particularly the lining of respiratory and GI tracts, as well as your saliva and your tears. So obviously, if he's testing for a disease, he's looking for a disease that affect those areas in the body. IgD assists in small amounts of blood and at least understood antibody. IgE is associated mainly with allergic reactions, right? Even if it's pollen or grass or, um, just any of the normal allergies that someone would sustain, especially during the summer. A lot of the allergy testing is surrounding that as well. IgE is associated mainly with allergies. IgG is the most abundant type of antibody that is found in fluids or bodily fluids, protecting it against bacteria, viral infections. IgM is found mainly in blood and lymph fluid, and the first antibody to be made by the body to fight new infection. And remember, guys, your white blood count won't exceed high, or you won't have an elevator. Let me rephrase that. If you're been in contact with a new infection for the first time, or even if it's a reoccurrent cold, usually most times they know that you have an infection going on just by the CBC, the white blood count. So if your white blood count is normal, that may indicate that there's no infection. But if it's really high, and you're thinking high, that it's good in terms of being good, but actually no, because that means that your body is fighting off an infection. The reason why it's high is because it's telling all your white blood cells, hey, we have an infection. Let's work together to fight it off. And that's the only reason why it's high. Now, if it's too low, and you will get a patient that has a really low white blood count, it's generally because of things like, for instance, a patient had cancer and they went through chemotherapy or radiation. And oftentimes, when they go through that, it kills good and bad cells as well. So the white count will be theoretically low, and their means to fight off infection will be kind of depleted. So they have to take other measures or different measures to help, defend themselves, basically, in a sense of, being in contact with an infection, and what may last 2 or 3 days for us may kill them in a sense. So, immune responses and acquired immunities, you have natural acquired immunity, you have artificial acquired immunity, you have naturally acquired passive immunity, and you also have artificially acquired passive immunity as well. So, natural acquired active immunity occurs when a person is exposed to a live pathogen. A live pathogen develops the disease and becomes immune as a result of primary immune response. Okay. Artificially acquired active immunity can happen through a vaccine stimulates a primary response against an antigen without causing symptoms of the disease. Artificial acquired passive immunity is a short term for immunization. So we get immunizations often, right? So this would be an example of it. By injections of antibodies such as a gamma globulin that are not produced by recipient cells. Naturally acquired passive immunity acquired during pregnancy, in which certain antibodies are passed from maternal bloodstream into the fetal bloodstream. And remember, I said that, um, in layman's terms, your baby will take everything from you, and that means the good and the bad, right? So a lot of things if we're carrying, we need to give to the baby, and some things that we don't want, right, to be given to them, whether genetics and things of that nature. But in this case, you want them to get some of the antibodies and things that you have, so so the baby's able to fight off those infections. Without our help, especially with the first couple of weeks of life, without our help, it's almost impossible for them to fight it off because of the vitamin K's and things like that. Okay, so pathophysiology. Remember, we talked about pathophysiology, right? So we learned about the functions of the organs and the different body systems, but we're here to kind of understand the diseases that surrounds them. And once you understand anatomy and physiology, you're learning about the body systems. You learned about the heart, This week, we're learning about the lymphatic system, which is not as interesting as the heart, right? But you do have to understand each to understand why and what happens in the event if one doesn't work properly. And usually it's like a domino effect. So, for example, if the heart is not working, the kidneys will go down, right? And other things will go down. And it's just almost like a domino effect, is what and what I kind of wanted to put out there. So, common diseases and disorders. I've given you guys each a disease for the immune system, but not these, so to speak. Some of you do have them here, and some of you don't. Like I know I gave one of you celiac. I didn't. I did give one of you lupus. So a couple of them are here. But anyway, I'm gonna give you a brief and tutorial of them. It's only one more slide after this, so it's not too much longer, ladies. So, um, in response to unknown trigger to immune systems may be producing antibiotics that instead of fighting infection, attach the body's own tissues. Treatment, however, for autoimmune disease generally focus on reducing immune system activities. Now, cancer is uncontrolled growth of abnormal cells. Some are metastatic, meaning traveling, some stays in one area. But each one of the cancers that you will come across in the field, whether it's a really aggressive cancer, such as stomach or lung cancer, or stage one of, different things that can be cured, so to speak, or at least get into remission. But in any event, cancer is uncontrolled growth of abnormal cells, and usually the cause of it is unknown. Some may feel that's genetics and things of that nature. Although risk factors have been identified, including suppressed immune systems. Allergies. Allergies, think about allergies in a sense because many of us suffer from different allergies, but allergies are immune response to a substance not normally harmful to the body. However, a anaphylactic shock or anaphylaxis reaction, so to speak. That's when your windpipe and everything is closing down. For instance, if you're exposed to an antibiotic and you're allergic to it, your trachea, your windpipe closes. Not the normal, I got hives, I'll take an antihistamine, or Benadryl, or anything of that nature, and it goes away. I'm talking about life threatening. So that's what anaphylactic means. It means severe, life threatening. Chronic fatigue syndrome is thought to be an autoimmune response against nervous system, causing a person to be severely tired with no relief to gain through rest. Um, I'm kind of thinking that chronic fatigue syndrome and fibromyalgia is kind of in the same category nowadays, but lymphedema, however, occurs when a lymphatic vessel is blocked and fluid is unable to leak back out of the lymph vessels and the body tissues. Mono, we talked about mono, which is we all know as the Epstein-Barr virus. Many of us know it as the kissing disease, resulting from an autoimmune response as a symptomatic lupus erythematosus. Celiac disease is an immune reaction to eating gluten, which is a protein substance found in your wheat products, wheat, barley, rye, anything that you can think of, cereals, things like that. Okay. So that wasn't so bad, but I do have a couple of announcements and I am getting good at this, guys. It's less than an hour, so I'm getting really good at this. But in any event, um, in layman's terms, you have your lymphatic system, you have your lymph vessels, and you have organs such as your thymus, your spleen, and things of that nature. And then you have your immunity cells that helps get rid of certain infections. Even your regular white blood cells, we know that there have five different functions or different functions of the white blood cells: cynophils, basophils, um, I'm sorry, manophils. Can't remember all of them, but there's five. So know them all, guys. Know those. Look up the T and B cells so you can kind of get acquainted to those. So when you do hear about certain infections in the field, you understand what's going on. Maybe read up a little more on antibodies versus antigens and try to kind of get a good grounded understanding of that. I may look, I think I have a YouTube video on this as well. I may embed it. I'm gonna look for it now and try to embed it as well. But the what I wanted to talk about, guys, is many of you know because you've been with me quite some time, and some of you are leaving pretty soon. So this is week one. There's a lot of missing assignments with no name calling. Those of you that do have the missing assignments know who you are. I will not call out anyone's name, but I will ask you to do this today. I've already almost graded everything. So, what I would like for each of you to do is go in, look at your grades, determine if you're satisfied with that grade. And what I mean by that is that this is coming to the end of week two. We all know that we have holiday right around the corner. So after next week, we're going to be in holiday mode. I know it. I'm a human being, even though I'm much older than you guys. I'm a human being as well. I know what it's like to be enjoying your family.